going? Hello, my name is Zachary Scheidler. I'll be your student nurse today. Kid, give me your name and date of birth. Okay, Amy patient. All right, thank you. So today I'll be inserting your nasogastric tube, and that's a tube that goes from your nose to your stomach, and it's for suctioning, possible suctioning, and administering some medications through the oral route or food. So, okay, I'm going to check my area, provide privacy, hand hygiene. Okay, and raise the bed to working height. Okay, that's good. Patient, put the patient in high Fowler's position. Okay. Place the patient in high Fowler's position.
I think you need to talk a little bit louder. Probably. Because maybe just a little bit louder.
Okay. Okay, we have the patient in high Fowler's position. So I'm going to check my contents, my stuff, get everything I need out. Alright. Have some water for the patient. And I have my tube, nasogastric tube, Kleenex, pH strips, and lubricant, tape, stopper, put on the end to stop it, syringe, and okay, benzoin to add to the patient's nose. Okay. Okay. All right. Have all my supplies done. Going to check which nostril nair to use. So, sir, could you breathe in on the opposite nair that I'm holding now? Okay. Could you breathe in on the opposite nair I'm holding now? Okay. Both nairs sound good. I'm going to use the one closest to me for ease, access. Okay. Now let me apply gloves. Not a glove. Alright, now go ahead and get my tape ready. Should have done that before the tape go up. Okay, I'm going to need 3 pieces of tape. One to put on his cheek, one to put one for his nose to hold the tube, and one for the patient's clothing. And the one on the nose, I'm going to go ahead and split it, get it ready so it can wrap around the tube. And one more for patient's clothing. Alright, have my tape ready. Everything's good. I'm going to apply this to the patient. Put this over the patient's chest. Keep the patient clean. If they were to throw up, that would keep it clean, keep us from having to watch the patient. Alright. Okay. Then I'm going to give the patient basin. Basin. Sir, could you hold this in one hand? Put this in the other hand. This is for the patient to be able to drink some water. Here, okay, hold it in the hand. Okay. All right. Now I'm going to measure the tube. Make sure I have correct tube. Okay. Start by putting the tube on the nose, on the tip of his nose, and then go back to his ear. And then I'm going to go to the end of the sternum, the xiphoid process. Okay. All right. I have that. Have that marked. Okay. Place this back ready. All right. I'm going to mark my spot with tape. There we go. Okay, I'm going to take the tip of the tube and put it in lubrication, water-soluble lubrication jelly. Okay. Now it's ready to administer. Make sure the end of the tube was coiled around my finger. Okay. Good. All right. Okay, now we're ready to administer the tube. I'm going to ask the patient to tilt his head back, and I'll assist with that just a little. There we go. Okay, and insert the tube into there, towards the septum, and downwards. Okay, now I'm going to instruct the patient to take a sip of water after I get past the nasopharynx. You do that and swallow. Okay. Take another sip and swallow. Thank you. Just keep inserting it down as he swallows. Alright, okay. Since I don't have good lubrication on this and we're using a mannequin, that's as far as it'll go. It won't go down to the end of the tube, but just for future and on a regular patient and with good lubrication, we will go down to the marked. It'll go all the way up to his nose, where I have marked. Okay, well, I'm going to want to apply some tape to the patient's cheek, hold it to his cheek. It's very hard to do with gloves. Hold it to the patient's cheek. Okay. And then we'll take my syringe because I need to check the pH. I will remove my clamp at the end and keep the tube on the patient's cheek. Can't remove the end of the tube, which I had closed. Move that. Place the syringe in there. Okay. Pull it back. Get some of the gastric contents in it. Okay. Okay. And while I'm doing that, I'm going to ask the patient to check for placement. I'm going to ask the patient to speak. And okay, can you speak? Okay, he spoke. This is good. So I believe it's not in the, and it does not sound like it made respiratory distress. So it sounds like it's not in his lungs. I'm going to check the pH of the gastric contents. So I'm going to take my pH paper out. Okay. I'm going to put just a little bit onto the pH paper, just enough to get it moist. There we go. And I'll take my pH paper and I'll check it against the kit, and we'll check. And you want it to be within 0 to 4 on the pH, and that is, so his, we're checking it, this is a 2, that is within normal range of the stomach gastric juice pH. So he is good. Okay, that should be good. Now we're going to go ahead, since we have good placement, I'm going to put the benzoin on his nose. That's good. Okay, and then go ahead and tape to the patient's nose. Okay, and also I wanted to look inside of his mouth make sure the tube is not coiled in the back of his throat. Seems to be good. Right. So wrap it around the patient's nose. Okay, I'm going to take the other side and then across. Wrap that around neatly around the patient's nose the opposite way of the first one. Okay, keep that out of his nose. There we go. Alright, make sure to get another piece of tape for his cheek because that's not holding very well. That's not holding very well, so I'm going to apply another one to his cheek. Flat. Okay, well, I'll apply it there. I'm going to apply it to his clothing. There we go. Alright. Okay. Now I'm going to put water. If you need any water to clean things up, it's good. Okay. I'm going to hook this up, whatever it needs to be hooked up at, and raise this basin. Okay, and I'm going to lower the bed down, put him in about 30 degrees angle, 30, be comfortable, and lower the bed down. Good position. The side rails were not in my way, but if they were, I would raise them back. I did not have to lower them because they were not in my way. The bed is in the lowest position. Everything's good. I'm going to clean up my area and document in the EHR. Okay, and then I'm going to go down and take the patient to, okay, yeah. Well, I'll give the patient his call light. Here's your call light. You can show the patient that he can call at any point in time. If he needs anything, just call and one of the nurses will come assist him. And we'll take the document down with the doctor's orders, physician's orders. We'll take them down to the X-ray for placement. Make sure the placement of the endogastric tube is correct. That is it. Thank you very much. All right, so I'll leave. Now I'll come back. I'm back here for the second time. Hey, my name is Zach Shiver. I'll be your nurse today. Can you tell me your name, your date of birth? Amy, patient? Okay. Good. Thank you. All right. Okay. Going to have quite good hand hygiene and give us privacy. All right. So today I'm going to be removing your nasogastric tube, and by doing that, I'm going to turn off the suction. It's not hooked up, but if it was, we would remove the suction from it. But this is good. Okay. Going to put on my gloves. All right. Give the patient, put this over the patient, keep them clean, possible back. All right. Just Kleenex to keep the patient clean, to wipe the patient's nose and try and keep everything clean and to catch any gastric juices. We have that. The basin's here. You can give the patient his basin just in case he feels any throw up or anything. He could throw up in the basin. All right, and I believe that's everything. Okay. All right. Now I'm going to remove the tape off the patient's clothing. And remove the tape off the patient's nose. Alright. Good. Okay. Next we're going to take his Kleenex in the hand. Now instruct the patient, can you hold your breath while I'm pulling this tube out? Thank you. Hold your breath. So I'm pulling the tube out. steady motion. Wrap it in the Kleenex. And place the tube in the red biohazard container bag. Okay. All right. That's out of the way. Clean up my station. Now, if I had a washcloth, I'd use the washcloth, clean the patient up, and allow them to blow their nose and just clean up. And remove the gloves. Okay. That's good. Patient, okay. Make sure the patient's comfortable. Lower the bed down. Put him back in resting position. Make sure if he wasn't already in it, and lower the bed down. Okay. We're good. And that's it. That's all. That's everything today. I'm going to document on the EHR. Make sure you have your call out here. Call documenting that I moved the nasogastric tube. So that's it. Thank you.